But yeah, I mean, I guess we can just jump into it. So I wanted to start with sort of what motivates people to get, especially like cosmetic plastic surgery. Because when you have the dog bite, I mean, it's very reasonable to most people that, you know, you'd want to be corrected back to how you looked before the dog bite, especially as a kid. But what some people don't understand is like, you know, kind of more cosmetic, aesthetic procedures where it's like completely elective. Like people, you know, they look fine, but
Hmm.
yet they want something adjusted. You know, maybe it's because of, you know, the aging process and something sagging now. They still look fine, but you know, they look different than how they looked 20 years ago. Or they like, you know, they like a certain person on TV and they're like, well, when I look at myself in the mirror, I see a thin lip and that person has a big lip and everyone likes them, so I want to be more like them. And then they want a little sort of enhancement or a little tweak. And so, you know, the way I see it, most of the patients who come to me, they really do just want like, you know, a little bit more self-confidence, kind of a self-esteem boost. And they're not asking for anything drastic for the most part. And they're usually very realistic with me. I tell them the risks, they understand them. And, you know, most of them end up pretty happy with their surgeries. But again, that's the majority. And maybe I'm
Hmm.
fortunate in my practice. I think I scare away some of those who just, they have money and they want to pay, but they want like insane overhauls. And I just, you know, I ask them a lot of questions. I talk to them a lot, and I think some of them sort of they're like, "Wait a second, he's asking too many questions. I gotta go find someone else." But that's been my experience. You know, I
Yeah.
don't know if you've dealt with it on your end
Hmm.
of things, but I'd love to kind of hear
Yeah.
your thoughts.
No, I think that from my experience with people that are going for plastic surgery, I mean, they have the body image dissatisfaction, right? I mean, they want to look more normal, whatever normal is to them. They just don't want to stand out in an obvious way. They don't
Mhm.
want people to comment on them. They don't want to feel, more self-conscious, or they just want their physical appearance to be more in line with the way that they, feel like their personality is. So they want some kind of, there's a mismatch and they want to, make it feel better, make it match. I
Mhm.
think that there's, this, we call it like the halo effect. It's, the way that people are hardwired to have this positive response to physical attraction. And, when you see there's a cognitive bias, if there's a positive traits in one way or another, you kind of get this overall positive evaluation of somebody.
Mhm.
So, if you see somebody who's physically attractive, then you feel like they're more intelligent or more trustworthy. So a lot of people would say, well, who wouldn't want that, right? I mean, doesn't want to reap the benefits, from the halo effect, so that strangers or colleagues or other people, just feel or say, more positive things about them. So I think that it's a combination. And a lot of my work is where, in therapy, I'm trying to separate people's emotional well-beings from others' perception. So,
Mhm.
if it's all about what other people think or about what a relationship, thinks of them, it's a lot
Mhm.
harder because, you can't fix a relationship with some kind of cosmetic surgery. So, my job is to try to improve their self-esteem and their self-confidence internally from what they think and what they feel about themselves, rather than having it rely so much on what other people think from a surgical aspect. So I think that there's all different reasons why people get surgery. When I'm hearing it and that's about, I need to have this surgery done so this person thinks I'm more attractive, or it's going to help the relationship, or, it's going
Right.
to make my life much better, then it's kind of, more of a red flag for me. Okay, let's take a pause. Let's try to work on this. Let's try to figure out really what's going on and process it without needing to run to get a surgery, which likely will not fix that problem.